Cross. I'm filling in for Cameron Perez-Verdilla, who is on. I'm Wednesday, October 5th. It is 11 meeting. Before we get keeping items, please make sure that if you would like to speak, that you use your status bar and go ahead and raise your hand on Teams. And then after you're done, or if you've just changed your mind, please go ahead and lower your hand. Confusion whether or not you need to speak again. And second, if you do want to speak, if you're on your phone, you're going to automatically be muted unless you hit *6. So again, raise your hand on the Teams, and then if you do want to go ahead and hit. All right, with those housekeeping items, fantastic presentation. We've got a bunch of things taking place today, so out of interest of time, we'll go ahead and start with our introduction. First with our assembly members who are MOA staff, APD, fire department. Again, I'm Kevin Cross, making my introduction, and then next in queue I have Jamie.
Here. Wait, is that what you're doing, calling roll?
Just having people who's on here. For those individuals, since this is a Teams recording, it's important, I think, audibly, because this will be an audible recording, necessarily a video. Not everybody have speak who you. We'll just with the regular updates. Let's see, who else do we have? We have Jamie, and then we have Sean Case. Do you care to make your introduction?
Sean Case, Deputy Chief, Anchorage Police Department.
Thank you. Amy Demboski.
Good morning, Mr. Cross and Assembly members. I am here.
Thank you very much. We have Blair.
Yes, this is Blair Christensen, acting municipal attorney, and I'm here with Raylene Griffith, the Labor Relations Director, is also in the room with me.
Thank you. We have Forrest Dunbar.
Here.
For attending, Forrest. Elizabeth Davidson. Yes, she's a guest. And then.
Yes, I'm a sign language interpreter.
Oh, thank you. And Sunny, forgive me if I.
Sunny Guerin, Community Relations Director with APD.
Thank you. We have Chief Pearl.
Morning, Mike Curl, the Anchorage Chief of Police, sorry.
Thank you. Suzanne LaFrance.
Suzanne LaFrance, District 6 Assembly.
Oh, I see Pete McHugh. He's probably scrambling to hit *6 on his phone.
Yeah, Pete Peterson present.
There he is. Thanks, Pete. Felix Rivera.
Felix Rivera, also present.
Thank you, Felix. Shelley Roten.
Good morning, Mr. Cross.
Good morning, Shelley. It's a pleasure to have you here this morning. And Chris Stanley.
Yes, I am here for the Department of Law Criminal.
Yes, if you speak, I appreciate you guys speaking your titles. And then I have, we have some folks, we have some other individuals online. It doesn't give a name, so would you introduce yourselves for those whom I don't have an ID for? Okay, well. All right, see if anybody else popped up. All right, well, fantastic. Now that we've done our call to order, we've done our introductions. Chief Curl, APD regular updates.
Okay, good morning. So Amelia, if you could, I have 5 slides going. I'm going to go over the third quarter crime stats. So here we're looking at the homicides for the third quarter. As you can see, we've been trending up after COVID. We had 2 years, the COVID years, where the homicides were down. We're trending back up. We're still we're about average where we were before COVID. Just on a side note, even though homicides are up a lot, every 22 of these 24 homicides have been. We do have suspects in custody, and we do have leads on the other 2. Just working those right now. It's an odd year for homicides. There's been a lot of domestic violence homicides this year, and just a lot of one-off homicides that we really, there's nothing that would indicate that there's anything that law enforcement could have done to prevent some of these homicides. So we are trending back up, but we're right about on average where we have been for the years prior to COVID. Next slide. So these are our third quarter stats, just the for property crimes. As you can see, thefts are down, burglaries are down, stolen vehicles are down, DUIs are down, vandalisms are up a little bit from last year and the previous years, but crime, the property crimes continue to trend downward, which is just a testament to the work of the police officers and the citizens taking crime prevention methods. Next slide. And then this is the first to third quarter, just comparing crimes overall from the previous quarters. This covers the from year to date of crimes. So you can look at those stats and you can see that for the most part, the crimes are trending down a bit for property crimes. We're going to go to violent crimes for the third quarter. We've seen a slight uptick in assaults from the previous quarter. Sexual assaults have trending down, and robberies, we did see a slight increase in robberies. And if you go next slide for the overall comparison for the year to date for third quarter, again, you can see it, we're still trending down a bit for violent crimes as well. So we've seen this steady, a pretty good decrease over the last few years. It's our crime suppression division. We have identified violent offenders. We continue to go after violent offenders, and you can see that it has a definite detrimental effect on the criminals, and as a result, we do see a reduction in crime in the city. Any questions on the crimes in the third quarter or from the first to the third quarter?
If you have any questions, raise your hand. I also do want to note that we have also been joined by Randy Holt.
Okay, let's go back to the agenda.
Yeah. Chief Carl, I do have one question. This is all encouraging and excellent to see. How do equally sized cities across the United States, do we know how these, since we're trending downward, how we're looking in comparison?
Yeah, and Mr. Crouch, your volume cuts in and out, but I got the gist of your question. Violent crime in the lower 48, they've seen a dramatic increase. I could tell you if we knew exactly, we know what efforts we're taking. We are a public safety partnership. We work with PSP, we work with the feds. Our working relationship with the state and the federal agencies here is phenomenal. We have a common goal, and that's to make Anchorage and the state of Alaska a safer place to live. That's not the case in the lower 48. A lot of crime in the lower 48, they have seen an uptick. They saw a dramatic uptick during COVID, which we did not see, and they're continuing to see upward trends in crime. And we keep going on. I think the culture up here is different. The work relationships we have with our partners is phenomenal, and our citizens, we have our citizens are the best in the country.
Thank you.
I'm going to skip over body cam because I'm going to cover the tow update first. That's next. As you know, I cut off towing for about a month because I ran out of money. We're working with the assembly, and I know on the 11th, you guys actually bringing forward a proposal to increase my towing budget. With that good faith effort on the part of the assembly, I'm going to hope that that does get approved because we do need to tow vehicles. I actually started towing junk vehicles again on Monday. We had quite a backlog of junk vehicles that have been building up in the city, and I wanted to get those off the street before the first snowfall. So with the good faith gesture by the assembly going to increase our money, I just felt it was reasonable for the police department to do our part and start towing vehicles again. So we have started towing junk vehicles again, and we should see them clear out pretty quickly as I know that our junk vehicle contractor has been keeping a list, and they're probably very busy towing junk vehicles right about now. Any questions about the towing of vehicles? Fantastic. So Deputy Chief Case is going to talk about the next two things. He's going to give a quick update on the body cameras, and then he's going to talk about the training report. This is reference the $500,000 that the assembly gave us out of alcohol tax to increase the training of our officers in the police department. Sean, take it away.
We do have a question from Ms. Fowler. Go ahead.
Sorry, Mr. Cross. Yeah, I have a question, Chief. You said that you guys are going to start going ahead and towing the vehicles without the funds being appropriated right now. Could you tell me what the status will be in Eagle River?
I will find out those. I will find out about those two vehicles, and I'll text you later, Jamie.
That sounds great. Thank you. I appreciate it.
All right.
All right.
Question. Chief Case, thank you.
Body cam update. So we're going to arbitration on the body cam policy with the Anchorage Police Department Employees Association. We have selected an arbitrator, and we're now selecting dates to go to arbitration. Arbitrators are a little bit booked up, so that's that to be determined on what those dates are going to be for the length of time that we need to go to arbitration. So other than that, there's really nothing new on the body cam update. I would assume that next month we'll be able to let you know when we're actually going to arbitration to have a little bit more firm timeline.
Okay.
If there's no questions.
Now, do we have any questions for Chief Case regarding the update? All right. I remember at the last meeting, Chief Case, we were looking and hopefully a public statement regarding those processes. You know, I can speak for myself and perhaps many other assembly members. Narrow a day goes by that we.
Mr. Cross, I hate to interrupt you, but you're coming in and out, and I can't hear you.
I apologize. I'm not sure what the difficulty is with the mic. Does it help if I speak slower?
I don't know if I should answer that question.
Yes, it does. Yes, it does.
Okay. Most of us on the assembly are receiving regular emails from the public regarding their concern with how long it's taking regarding the body cams. I know that you're in negotiations, and I understand that those take time. Possible to get a public regarding that or some sort of press release or something we could provide other than they're working on it. My fear is that individuals and that the public is getting impatient with us. Thank you.
A quick answer for that is there's two things. We have to remember there's two things happen simultaneously. It's not just the policy and now arbitration with the APDEA, but there's also the purchasing of the body cameras. That is also a government process, and that's all laid out in the format that it exists. So both those two things are going to take time. And once the contract's out to bid, it's going to be out for 60 days. And then we have to evaluate those. And most everyone on the line is familiar with that process. So I understand the frustration. Believe me, we're getting numerous questions and concerns as well regarding the process. And I think that we certainly don't have a problem with at least kind of spelling out that process a little bit more clearly, because it is a pretty formalized process. This is not something that's kind of guesswork.
I think the public that could point to something along where we're at in the process. These items take an undetermined amount of time, but understand, although it's taking longer than anticipated, we are moving in the right direction. Action, I guess, would be. Excellent.
Thank you, Mr. Cross. I assumed that you were calling on me. Sorry, your mic does cut out, but when you talk slower, it does help. So I'm just going to jump right in. Two things I want to touch on first with this. With respect to body cams and the mayor's position on this, I think what you'll see in the 2023 budget that was proposed is APD has a special tax levy specifically for IT related components. Previously, it's been used for the CAT RMS project, but what you will see is a fully utilized tax levy. And what that is designed to do is to start to supplement APD to move forward in the process to implement body-worn cams. So in addition to body-worn cameras, you'll see redaction clerks. APD is moving forward with the process of purchasing the body-worn cameras, with going forward. So once that negotiated process with the union is completed, we are being ready to go. So these things, there's a lot of operational things that are happening in the background. And that's things people don't see. But what really has to be just highlighted, and I think Mr. Cross, this is what you're getting to, is yes, we are doing all these things in the background, and the 2023 budget demonstrates APD and the administration's commitment to implement body-worn cameras. But because of labor rules and collective bargaining agreements, there has to be an agreement with the union as far as what those working conditions will look like, what the policy is relating to the body-worn cameras. So no matter what we do on the administration side, the operations side, until that is resolved, all those nuances in the policy are resolved between the administration and the union, we won't be able to go live with that. And Ms. Christensen, if you have specific questions, Mr. Cross or any of the assembly members, as far as the labor contract, I know Director Griffith is there with Ms. Christensen, and she can answer those specific. But I just want to reassure every member of the assembly and the public that the mayor and APD are committed to implementing the body-worn cameras. We're moving forward in that effort, and I think the 2023 budget demonstrates that. Thank you.
Thank you, Amy. Hopefully my mic is working better. I switched monitors, so hopefully I'm clear. I don't see any other questions regarding body cams, so if we can move into the training report.
Absolutely. So just a little background on training at the police department outside of academy training or in-service training. Typically on a reoccurring basis, we have training like firearms, CPR, AED, data master, etc. Those types of things that require certification, either for some legal reason or some manufacturer reason to run a piece of equipment. And we see that training happen on a regular basis. Then we have less reoccurring training, and sometimes get sacrificed for time, for money, all sorts of reasons. And those would include things like, the utilization of less lethal options, report writing, legal updates, and scenario-based training. And then additionally, we have kind of what I'll just refer to as this kind of softer skills training that also typically does get neglected along the way. And as most people on the call know, this money was very specific on what it could be utilized for because it fell under the alcohol tax. And so it was those areas of training that we were able to apply the money to. We broke it up into 2 blocks of training. The training began on September 26th. That's a 10-hour block of training for all of our sworn employees and a significant number of our non-sworn employees. Then we'll switch to the last 4-hour block of training. That's going to be a scenario-based training block for our sworn employees. So the first 10-hour block is primarily classroom environment. The class is focused on de-escalation. We got case law updates. We have a class that's on fair and impartial policing. That class has already been given to the entire command staff. We focused on officer wellness and taking care of themselves so they can provide better service to the community. And then we had some updates on some defensive tactics skills that we needed to get update on. The last 4-hour block of training will, as I mentioned, will start in November, and that will be scenario-based training on all of those skills that we trained in the 10-hour block that's currently going on right now. I think, as these skills kind of all fit together, one of the areas that we're looking at in terms of, some impact of the training is, the rate that we use force as it relates to arrest, referred to as a force to arrest ratio, which a goal is of 5%. And we're always monitoring the things that we do, not only in training, but then what we do in the field. And as we look at our practices in training and our application in the field and looking at arrest reports and use of force reports, we have identified a couple areas that, again, the training is going to be focusing on, which is slowing down the context with folks that are under the influence of alcohol. Their reaction time and their ability to comprehend sometimes a little slower. And so our officers, when safe to do so, can also kind of take that time to slow down. And then also communication prior to making an arrest to try to impact kind of that arrest to force ratio that we're starting to focus on. So that's what I have on the in-service training that we're doing for 2022.
Excellent. Any questions for Chief? Okay. All right, seeing none. I have a presentation in our Q intervention team, APD. Do we know who's going to provide that presentation for us?
I'm sorry, Mr. Cross, did you say the mobile intervention team?
Yeah, mobile intervention team. I have a presentation that was sent to me for today's meeting.
Yep, and I think what the intent was, I had asked if we could give the assembly an update on the MCT team and what efforts we were making to go 24/7, and that's going to intertwine with the MIT. So I was hoping we could kind of just do it together.
Okay. On to our department regular updates. Let's see.
Chief Shaggy normally gives those, and I don't see him on here, so
Yeah.
I'm not sure there's a representative.
I'm here for the administration.
Thank you. Yeah, if we can get somebody to provide the update from the Aiken Fire Department, see them in the list.
So again, I asked to have the MCT team put on there. I don't think in lieu of a regular update, we wanted to update the assembly on our efforts for MCT going 24/7 or mobile health crisis going 24/7. So is it okay if I just go ahead and start, Mr. Cross?
Yeah,
okay,
absolutely.
Perfect.
I appreciate that greatly.
All right, thank you so much. We thought this would be an area of interest for the assembly, so we had asked to give an update on our efforts to implement 24/7. mental health crisis response here in the municipality of Anchorage. It's the administration's goal to implement this 24/7, as we know it's the Assembly's goal as well. To discuss their efforts and our potential path forward, I wanted to turn it over to Acting Municipal Attorney Blair Christensen today. And again, she's with Director of Labor Relations, Raylene Griffith. And then to kind of feed into mental health crisis response for the municipality. We obviously know we have a component, which is the mobile crisis team, but we also have a much larger component that responds to mental health crisis, which is the MIT program at APD. So we wanted to talk about what we believe is our path forward in order to provide 24/7 mental health care. So I will just kick it over to Blair and Raylene and let them kind of take it from here.
Good morning. So I think that Raylene and I just wanted to talk about the general process we go through when we create positions and what we've done here. Generally, when we create positions within the municipality, HR looks at those positions and determines based on the work what union jurisdiction those fall into. And so for a long time now, we have been looking at those positions because we knew that the positions fall within 3 different unions kind of scope of duties. So the lower level clinicians fall within AMEA's jurisdiction of duties and would be done out of the health department. And then we're going to hear from DC Case in a little bit about how APDEA also has some jurisdiction within the scope of these duties. And then there was positions that had been started at the fire department, so that would be within IFF's jurisdiction of duties. We have been working hard. I'm sorry.
If you would forgive me, Amelia, would it possible for you to bring up the presentation that was? Yeah, thank you so much.
And so we have had a lot of meetings. We've done a lot of talking to the 3 departments whose employees would potentially be involved, AFD, AHD, and APD. And the conclusion we've come up with is that the most reasonable way to do this, the way that would comply with all of our contracts and all the labor laws, would be to do a task force model. So you would have employees in different departments doing different aspects of this work, and those employees would all work together in a task force. We have lots of different task forces that happen within the municipality and with the municipality and other organizations. And so this is not really a new concept for us, but this task force would be headed by APD because they've been doing this type of work the longest, and they're also responsible for dispatching all of this work. All the calls for service come in through the APD dispatch center. And so it made the most sense to have APD be in charge of this work, but that we would also create positions within AHD, and potentially those employees would report on a daily basis to the Anchorage Police Department, but the department assignment would be the health department or whatever it might be. I'm going to turn it over to Deputy Chief Case now to talk about APD's kind of history with this type of work and kind of the statistics on how this work is dispatched.
Okay, there's 2 terms that I'm going to talk about throughout the next. I got about 9 slides, so hopefully you all can hang through me through the 9 slides. The first one is crisis intervention team. That refers to that's a 40-hour training course that our officers started, and I'll kind of give a timeline on when these 2 kind of terms became within the department. We have approximately 150 officers currently that have gone through that training. And it's not just officers, it's also dispatch and records clerks personnel as well, because they have direct contact with the public. And then the term mobile intervention team is used for a patrol officer that's CIT or crisis intervention team trained, as well as a mental health clinician. One is technically what they are. So someone that's providing a level of mental health support, if you will. Next slide, please. A real quick timeline here. We started our CIT program with the Anchorage Police Department in 2001. That's a program that started in Nashville, Tennessee, with our first CIT class. We've been running about one class a year since we started training that class. By 2007, we were presenting in Nashville, Tennessee at the annual CIT conference. We were started to be nationally recognized in 2007 for our CIT program and our implementation throughout not only Anchorage, throughout the state of Alaska, as we do statewide courses. By 2011, our 10-year anniversary, we'd already received 5 community awards for that particular program. Now, outside of that 40-hour training class that we give where our employees are CIT certified, we also provide anywhere from 20 to 40 hours in the academy that is mental health related. So that's portions of the CIT course. That also bleeds over to courses like de-escalation, as well as scenario-based training. We also have classes in the academy where we focus on special needs like autism and interacting with the deaf and hard of hearing community. So roughly 40 hours in total that deal with either mental health or special needs our officers get in the academy, and then they're selected. So they actually put in and then are selected to go to a 40-hour CIT course once they're completed field training and they're out in the field and they kind of have a little bit of experience. So everybody within the department that's CIT trained, it's because they want to have this certification and they want to increase kind of their ability to provide service to the community. Next slide, please. In 2013, we took one of our CIT trained officers and we assigned her full-time as a CIT officer. And really what was happening between 2001 and 2013 is a lot of the work that our CIT employees were doing throughout the community, it wasn't even a secondary duty. They were going to calls for service and they were using some of the skills. And what we found is there was a pretty significant deficiency in the community when it comes to there are resources that are available within Anchorage that people that are consistent callers over and over again and utilizing a lot of resources that our CIT officers could help them and kind of connect them to those services. So we assigned one full-time CIT officer to basically do that job as her full-time job. She retired in 2015, and we got our second CIT officer in that position, and she's currently still in that position. In 2018, we added what I referred to at the first slide as the mobile intervention team. So we added that social worker, that caseworker on to as a team member with the CIT officer. So they work in tandem together as of 2018. Next slide, please. So some of the reasons why we went to that model is we're really trying to reduce calls for service on patrol. We're trying to reduce use of force on those in mental health crisis and kind of that reoccurring calls, not only for the police department, but also high utilizers of resources throughout the municipality. Our MIT team is dispatched by our dispatch center, or they have access to all of the calls that are happening currently in the field. So it's not just, they're not just dispatched to straight mental health calls. They've kind of developed over the last 5 years the ability to look at different calls and understand just by some of the comments that there may be a mental health component. So they're able to kind of self-dispatch themselves as well to those calls. And then additionally, everything that's a mental health or a suicide related call is forwarded to that team, the police reports. They review those police reports so that they can do follow-up with some of those clients that they weren't on duty or didn't have direct contact with. Next slide, please. Once we were in the program for about a year and had this co-response team, we spent the first about 6 months of 2019 of actually kind of breaking down calls for service and reports. So this is just an example of March of 2019. 821 police reports were reviewed by the team. And of those police reports, 173 people were taken to the hospital and put on a mental health hold. And as we reviewed those calls for service and those police reports, what we found is that only about 40 of those people needed to be transported and put on a Title 47 hold. The problem is there was no other resources available to the police department or any government entity, quite frankly, at that point in time. And so the default was always the hospital, which creates a lot of time for the officers because those intakes are generally between 1 hour and 3 hours. And additionally, it's utilizing an excessive amount of resources for the hospitals. The more we take on a Title 47 hold, the longer our wait time is to get them in. And so that really kind of just brought home the fact that the more services that we could provide directly in the field, the more likely that we could reduce those 173 transports per month. A lot of those 173, in fact, on this particular month alone, 65, just by reading the police report alone, could have been handled in the field by the MIT team. So a very valuable reduction of resources and also just a better way to interact with this population. Sometimes being on a Title 47 isn't the best response, depending on what level of crisis that you're in. Next slide, please. So let's kind of give you a current picture of where we're at today. If you look up at the top there, April 7th through September 26th is what this chart is kind of looking at. And what this tells us in our response is, first of all, during that period of time, we had 6,332 mental health calls for service that came into the Anchorage Police Department that we handled. Obviously, our MIT team only gets to deal with a very small number, approximately 90 per month is what they have the capacity to respond to. But if you look at that chart, the above average, that 11%, the below average, what that means is approximately 2 calls a month. And then our two frequent categories there are 7% and 10%. That whole side of that pie chart, those are the folks that are really going to be the clientele that MIT tries to deal with, the ones that are using multiple calls per month. Our patrol is more along that 31%. And so we've developed a way that we can kind of displace calls either to MIT or through our patrol officers. If you look on the right side, the July, August, September, those numbers are what we've handled the last 3 months. And I do apologize, September is wrong. That was my error in entering that. It's actually 1,182 calls for service in September. So very consistent in the calls that we handle from month to month. Next slide, please. One too many. So I'll do whatever you give me.
Sorry, this is the next slide that I have.
Okay, thank you. So kind of what we actually do now, as this has progressed throughout the 5 years, I'm not going to read everything on there, but I'm going to point out a couple of things. About 2/3 down, you'll see that we do substance abuse screening in the field. That is our mental health clinician that's out in the field. So it's a much broader range than just straight mental health services. Because we can screen for substance abuse in the field, we have the ability to place people that we have come in contact with that need substance abuse treatment generally within 24 to 48 hours. We have a relationship with the programming that is available in Anchorage. So that's just some of the benefits that we have. The very last bullet point that you see there, our MIT officers and our MIT team have had 0 uses of force in 5 years, which statistically that's almost impossible to accomplish, but somehow we have. So these are not only significantly trained employees, but their focus is dealing with those in mental health crisis. And as I mentioned at the intro slide, we have 150 officers or employees in the department that are MIT trained, or excuse me, that are CIT trained, that have also devoted a lot of time and dedicated to interacting with those in mental health crisis, kind of on a different level. There's tons of anecdotal scenarios that I can give you on the types of things that our MIT team does when they have contact with people they see on a reoccurring basis. But some of them are just, making sure that they're staying on their meds, or sometimes even transporting them so that they can go get, medication or get their driver's license. Sometimes we don't think that we have a lot of benefits that are available to people living in Alaska, particularly through Medicaid services. Can't get those services unless you have a driver's license or some sort of identification. So it's those types of services that MIT gets involved in, so that they can kind of continue that care that's provided, or that can be provided to them. Next slide, please. So this is kind of where we're at now, with the exception of CareLine, and I'll talk about that here in just a second. So our calls come into the call center. Our next slide will go over the response algorithm that I'm referring to there. So we'll talk about that in a second. CareLine, we are ready to go to forward calls to the CareLine. We're just waiting for the CareLine to have enough employees to receive those calls. We don't want to break their system, since they are connected to 988 for the state of Alaska. As soon as we start forwarding calls to them, we will be their highest utilizer in the entire state. So that's all we're waiting for right now. We also have available, of course, the MIT team. We have patrol officers if MIT is not available. And then all follow-up does get routed back to MIT, whether or not they were on the call for service. So that's kind of our cycle of how we go through the calls into the call center. Last slide, please. And then finally, so this is our dashboard that we've kind of created, where we have kind of an algorithm. And I apologize, since this is in PDF form, it's kind of all at one time. So I'll try to walk through a little bit so it's not overwhelming. But the upper left-hand corner are current call statistics. Specifically, want to focus on the last three. So that upper 99% confidence interval. That means that we have 8 on an average, because this is over the last several months, on average 8+ people that are in that 1 percentile of a utilizer. We have 14 individuals that kind of rate in that we refer to as very frequent subjects, and then above average utilizers are 33. We have the ability, the next box to the right, the top 10 locations. We have the locations that are easily identifiable. And then also we have in the upper right-hand corner, the individuals that are highest utilizers. And then the bottom, down at the last graph there at the bottom, we're able to kind of look at when calls are coming in, where they're coming in, if somebody is a high utilizer. And if you look at the small circle in the lower right-hand corner, we can also tell in our call center immediately when the call comes in what we did on the call. So if we cleared it, if we reported, if we transported the individual. And so it helps that dispatch instantaneously determine whether or not we're going to forward it to the CARES line when that becomes available, if it's going to be a patrol call for service, if it can be something that can hold for MIT, because we have such a vast amount of data that's coming into the police department. We had to develop a tool that we could immediately utilize that information and make the quickest decisions possible to how we utilize our police resources in responding to mental health. With that, I will take any questions.
Thank you. Do we have any questions for Deputy Chief Case?
Mr. Cross, this is Miss Zalatel. I just wanted you to know I was here. I joined a little bit late. Thanks.
Fantastic. Thank you. Thank you for making your presence known. Happy to have you.
So, Mr. Cross, just to follow up, I think, the bottom line is, I think we all remain committed to making sure that we have 24/7 crisis mental health care response. And with the work of the Department of Law and the Labor Department, I think that we do see a path forward to create this task force to benefit from APD, AHD, and AFD. So we look forward to having more robust conversations with the Assembly on this as we kind of, pave that path forward to provide this service in our community 24/7.
Thank you. And yeah, just looking at locations for service calls. Obviously, we know that 1600 Gamble Street. I think this puts more emphasis. A little bit of what we spoke to if you were meeting that took place before this one. Other updates from our Anchorage Fire Department. I do not see Strage has logged in yet. So any other
Mr. Cross,
representative?
there are some folks in the queue, in the chat.
Thank you. I'm not seeing hands up in my little browser here. So let's see what we can get here.
So we typically use the chat and just put in queue.
Oh, excellent. Here, there you go. I was looking for little hands to go up, so I apologize. Let me see if I can get this dismissed.
I'm sorry, Mr. Cross, we've discovered some errors with the slides. Can we ask that be pulled down and that we be able to replace that with different slides? Thank you.
Beautiful. I apologize. I'm having difficulty seeing chats. It's not showing me any hands or anybody in there. Who do we have?
Mr. Chair, this is Pete. Mr. Chair, this is Pete. I'm next in the queue.
Pete, would you, that while I'm figuring out why I'm not getting indications on my side, would you go ahead and proceed and I will,
okay.
Thank you.
Thank you. I was looking at that previous slide, the very bottom, and it had a chart of what hours of the day the most calls came in, and that was rather small, and I wasn't able to read those numbers. And I was wondering if maybe Assistant Chief Case could go over those again. I would appreciate that. Thank you.
Thanks, Mr. Peterson. I'll tell you what, I can update you on those slides, provide them to you that are kind of larger so that you can see hours of the day. A couple of the blocks of information we can certainly provide, like hours of the day, which shift handling the most calls as it relates to those in mental health crisis.
Okay, great. Thank you.
Next in the queue, I'm still not getting indications on my side. I apologize.
I believe that's me, Mr. Cross, Ms. Salatel.
Thank you, Ms. Al.
Thank you. So my question is probably for the municipal manager, just based on the last statement she made. Is it your proposal then to have 24-hour coverage for behavioral health crisis response in the municipality be a combination of the mobile crisis team and the mobile intervention team? And if so, at some future point, can there be maybe a dedicated presentation about how those two things could work fairly seamlessly? Sorry, I'm still wrapping my head around the concept.
No, great question. What's your second question?
I have a secondary question, which is, I guess I don't know. We often use these slides kind of right away, especially as going out to community council. So if there could just be a quick indication of what was an error on the slides so we don't perpetuate any misinformation, that would be really helpful. Or if the new replacement slide can be emailed out today, that would also be really good because we already have community councils coming up tonight.
Yeah, we will email it out today. And I think, I don't know if the Department of Law wants to weigh in on, but I think there was just some errors on the slide that they didn't intend for some information to be there. Blair, did you want to comment?
Yeah, it appears as though there's information on there that should have been redacted that we are going to need to pull down. So whoever's in charge of posting that to the website, that those slides are going to need to come down. And we're going to have to redact some information off that.
Oh, okay. Thank you. Thanks for being conscientious about that.
Yeah,
it was intended to be, but I think you might have been able to see through it. So sorry about that. So to your first question, Ms. Salatel, and this is the acting municipal attorney actually kind of gave a brief overview of some of the challenges and how we think we can navigate forward before you joined. But in general, you know, we do believe that there is a path forward, and it would be to utilize the resources of both the MCT team, the MIT team, as well as some of the clinicians at the health department. But we do think through a task force model, we could implement a 24/7 operation with respect to those union contracts that we've been trying to navigate some of that, union ownership work type things that we've been talking about for a few months. But we do think there's a path forward, and we're very excited to be able to leverage all the resources of multiple agencies in order to provide that service.
Got it. Thank you. And I'll go back and listen to the little bit of the beginning. My apologies for being late. Thanks, Mr. Cross.
No, thank you. And I think we found a workaround. I don't currently see anybody here. All right. Seeing none, and I have, just so you guys know, I have Amelia helping me. She's texting me people as they pop into the queue box. I'm not getting a response on my side, so I apologize profusely. As we know, we've been having all kinds of technical issues recently here at the MO. Anything else with AFD updates?
No, Mr. Cross, we just appreciate you letting us substitute our normal update to be able to update the assembly on the efforts we've made to implement or find a path forward to implement mental health care 24/7. So we appreciate you letting us do a little switcheroo here, but we thought it was an important topic and appreciate your time.
Well, it is an important topic, and it seems to be one that we deal with daily here. And so I appreciate the information and the presentation. All right, seeing nobody else in the queue for department updates from AFD, to law department updates. Sarah, do you have a law update for us?
Good morning. This is Sarah Stanley, City Prosecutor. I wanted to give you an update on our staffing situation. We have a wonderful and dedicated team of both attorneys and non-attorney staff down here on the second floor. We have about 30 employees total. And at the moment, we have 5 open attorney positions. So to give you a sense of what that means, we have 14 attorneys on site. Usually we now have 9. On a normal Monday with no added hearings, we have 10 court hearings we have to cover. So that gives you a sense of how tight it's going to be here very shortly. We have 2 concerns with that. One is, besides, just the obvious concerns of covering court hearings and getting all the work done. One is finding new people to hire, and then the other is retaining the people we have. And that's not helped right now by the fact that the DA's office for the state is about to get a 20% across the board raise. So we're in a situation where sometimes my attorneys go to court and they run into someone from the DA's office who helpfully points out to them the differentiation in pay, maybe even shows them a salary grid, and tries to, hire our people. So we do have an ask in the budget to try to address some of those issues so that we can try to hold on to our really fabulous attorneys and get some new attorneys to join our team. So I just want you to be aware of that going into this budget season, and just so you're aware of what's happening down here on the second floor. It's probably, and I'm going to defer to my supervisor, Acting Municipal Attorney Blair Christensen.
Thank you, Sarah. I just wanted to piggyback off what Sarah said, is that the state gave 20% raises to all of the attorneys that work for the state. And so it is an issue that the Department of Law has across the whole department, both the civil and criminal divisions. And so the budget item that Sarah's talking about would incorporate all of the attorneys within the Department of Law, because we have just within the last month seen a retention issue just within our office and within Sarah's office And so I just wanted to clarify that one point. Thank you.
And I see there's another hand up. I do have something else, but I'm happy to address any questions about this part. I don't know if the chair is. I can't see whose hand is up.
It looks like it's Meg.
Yep, and I see Kevin's mouth moving, but there's no audio. So I'm not sure if he's calling at me, but I'm going to say yes, he is calling at me. So Miss Quinn Davidson and I, we worked with municipal attorney under 2 administrations ago to really think about and getting a salary analysis about how salaries line up within the municipal attorney's office. And of course, we would welcome the prosecutor's office as well to provide that information. We definitely have been trying to find ways to make sure those positions remain competitive. So any of that analysis would be really helpful to have comparisons. You know, if you know in exit interviews, folks are leaving for either better benefits or better salaries, because we do acknowledge the cost of turnover. So that kind of backup information in addition to the budgetary request will be very helpful. So I just wanted to flag that for you. Thanks.
Thank you.
Thank you, Ms. Sawatelle. And I will tell you that as part of our budgetary ask, we are working on that analysis now. So we'll be happy to provide you with any information we can.
Oh, go ahead.
Please proceed.
The other piece of news I have is maybe not the best to go right after my former topic, which is that this is my last meeting with you because I actually have accepted a job with the state. And it has been such a pleasure to work with all of you these last 3 years and to get to know the Public Safety Committee and to get to work with the Assembly. I so appreciate your support with our change to the DV code about the child abuse and harassment, those pieces a couple summers ago. And it's been such a pleasure to get to work with the 7th and 8th floors. I just really enjoy that public safety really is something we can all get behind and work on together. And I really appreciate your support for our office. And also thank you for sort of gently guiding me in the ways of legislative change and, you know, filing, changing the code, and your patience with me. So it's very bittersweet, but I will be moving on. I did want to share that Monica Elkington is on the call right now. She's waving. I don't know if you can see her. She is going to be the acting municipal prosecutor while the process goes forward to find my replacement. So if you need anything, Monica Elkington is the one to find on the email. So thank you.
Thank you so much for your hard work, and you will be missed.
Thank you.
Well, on that side, and our update from the law, we proceed to unfinished business. Check here. I don't see anybody in the queue. Well, let's go on. Now we'll move on to unfinished. Most of our unfinished business is actually being covered in our regular updates. So unless there's any business that I'm unaware of, I think we covered that with the towing update, body cam, training report, and mobile. See any other hands? No, I don't see anybody else with any.
Mr. Cross, I raised my hand. I apologize.
Yep. No, it just popped.
Okay. So I have an informational request. I hope now is the appropriate time. My understanding is the mobile crisis team puts out, I believe it may be a monthly report that circulates within the Anchorage Fire Department. And it would be really helpful to get those as members to see the substance of what's happening with the mobile crisis team. I think that would be really, if we can get them from a, kind of backdated, like to whenever they started, I think that'll be really important as we try to navigate this new proposal moving forward. Thank you.
Excellent. See any other hands? Thank you, Meg. We'll move on to new business. All right, here's your opportunity now. I guess here, I'll open up my queue for anybody who would like to bring forward. I don't see any. And now we have opportunity for audience participation. Your help with this one, just as if there's any people in the audience who can acknowledge you, your district, or if you put your name on the record, and then you will have 3 minutes for audience participation, 5 minutes for community council representing a group. Seeing none for our audience participation, comments from anybody in attendance to add before we wrap up. I don't see any. Well, seeing no other comments, if anybody has anything else to add, I will be looking for adjournment.
Move to adjourn.
Thank you.
Thanks, Kevin.
Thank you. We are adjourned. Thank you, team.
Thank you.
Thanks, everyone.